Hello, my name is Karen Athié. I am a psychologist and I will connect you from Brazil to present you a work about primary mental health care, education, and internet. This is me and where I live. The objective of this presentation is to find out how the internet can improve primary mental health care education through two steps. The first one is a literature review, and the second is to compare the results with three Brazilian experiences. I also used three main issues that helped me to think about these relationships. They are: how could the internet improve access to information about primary mental health care? How can the internet help to integrate primary care professionals and mental health professionals? And how cyberspace can improve interdisciplinary actions and collaborative care. The literature review was done in an international database using 4 keywords: primary care, mental health, education, and internet. Through this search, I found 22 references published in the last 3 years by only 9 countries. Well, exploring this review, the 3 categories found were individual mental health problems, with this group of problems as you see, social context, and collaborative care to on internet. In this last category, we highlighted 4 points. The first one is the internet is helping primary care teams without knowledge about mental health problems. The second is the internet is helping to give access to information about care. The next is the internet is helping to prevent mental health problems. And last, the internet is helping to give access to rural areas. So in order to illustrate this category, I would like to share with you a few examples such as telehealth, free online guides, conference and meetings online, and also educational apps. To get access is necessary an internet connection, a material support as mobiles and computers, and to know the appropriated filters that you need. The review shows us also that advantages of internet use for primary care and mental health integration can be understood from 2 different points of view. The first is patients' factors. In this case, the anonymity reduces stigma and encourages help seeking, increasing access to psychotherapy. And the second is healthcare factors. In this case, the internet is helping to build a bridge to referral to mental health specialists and online support for primary care teams. Well, now I will share with you 3 Brazilian examples that I participated as a health professional. The first one is the program Mental Health and Primary Care on Telehealth as a Distance Education. In this experience, I moderated 20 seminars with the presence of a mental health specialist and a non-specialist to discuss mental health problems in 2 different points of view. The seminars are broadcast live with a chat and also are available on the platform. Up to the 13th program, 87 cities all over Brazil had access to these transmissions. The second experience that I had was distance learning, education through work program. This e-learning program was created to 40 undergraduate students over 4 weeks. For learn these students, firstly, to plan activities in group, and secondly, to develop communication skills, everything inside a closed community. The method was planned with all the actions taking place on the internet. Each week, the students answer issues online open to all other students and also evaluate 2 other answers written about the 3 same questions. The first is, did I like and why? The second is, was the information clear and why? And the last is, can I use these answers in my practice and how? We call it that the peer assessment. After a month, we had 56 answers, and 102 peer assessment as a collective production. To finishing the activity, we had a meeting where all the students presented in pairs these plans to make a group in primary health care. As a result, we had 7 new projects had been done to the unity of health. The last project that I am still participating is Community of Practice website. The cyberspace is a specialized social network in public health. The sponsor is Brazilian Ministry of Health, and the aims are to foster public health activities and to empower the professionals valuing this practical experience. As outcomes nowadays, it's one of the biggest Brazilian public cyberspace, shareable, with 36,000 profiles, around 5,000 experience shared, 100 communities, and 6 open courses. These 3 different experiences have 3 different network designs related to these aims. In the first experience, the telehealth, the design is centralized and not available to share. In the second experience, the learning education through work program, the design is distributed with a specific focus in a closed group. This experience can be reproduced in other groups but is not available to share. And in the last experience, the Community of Practice website, the design is decentralized and available to all and shareable. Well, before finishing this presentation, I would like to share with you 2 issues. The first one is inspired in a theory about education that I try to follow constantly. It is the popular education from Paulo Freire, and the question is, what can I learn from this experience? Or, what can we learn from this experience? And the second question is, how does this compare with the literature review? Summing up this presentation, I highlight 3 basic points about primary mental health care, education, and internet that I think can give us important tips about the subject. They are: the first one is the internet can improve access to primary mental health care in different ways. The second is the internet is helping to build bridges to integrate actions between primary care professionals and specialists. And the last is specialists need to help to improve the quality of information about primary mental health care on the internet. Well, that's it. I hope that we could exchange our ideas about all that. In the next slide, you can see my contact. See you soon, and thank you very much for your attention.
Criar meu website, fazer minha homepage. Com quantos gigabytes se faz uma jangada, barco que veleje. Criar meu website, fazer minha homepage. Com quantos gigabytes se faz uma jangada, barco que veleje. Que veleje nesse infomar, que aproveite a vazante da infomaré. Que leve muriqui do meu velho orixá ao porto de um disquete de um micro em Taipé. Barco que veleje nesse infomar, que aproveite a vazante da infomaré. Que leve meu e-mail lá até Calcutá, depois um hot link num site de Helsinki para